going to talk about why your heart is important for your feet, why it is important to look after your feet, and what a podiatrist can do for you. When you have cardiovascular or heart disease, the blood flow to your legs and feet can be affected. This is because people who have heart disease are 2 to 3 times more likely to have peripheral artery disease as well. Peripheral artery disease is a problem with the circulation where narrowed, blocked, or stiff blood vessels reduce blood flow to your limbs, usually the legs, which can lead to decreased blood flow to the feet. This can cause dry and shiny skin. The colour of your skin can change to a blue or purple colour, which is a sign that your skin is not getting enough oxygen from the blood flow. Itchiness, pain, numbness or coldness in your feet. Decrease in hair growth. Increased risk of injury when the skin is bumped, which can lead to the development of a wound. Reduced ability to heal. Increased risk of infection. Swelling in your legs, ankles or feet, which is a sign that the veins are unable to pump the blood back up to your heart properly. Cramping at the back of the legs when walking, which is a sign that your muscles are not getting enough oxygen from blood flow and need to rest. As you can see, it is quite important to look after your feet if you have heart disease. A regular foot care routine is important to prevent complications. You can follow some simple steps to make sure that you maintain good foot health. These include checking your feet every day for blisters as well as changes in skin colour and temperature. Cutting your toenails using clippers and following the natural curve of the nail. Do not cut if you cannot reach or see well, and do not cut your nails too short or cut down the side of your nails. Moisturize your feet daily to prevent dryness of the skin. Apply to the whole foot but not between the toes. Protect your feet with socks and shoes. Don't position your feet close to heaters, fires or hot water bottles, and do not soak them in very hot water. Look after any cuts on your feet by cleaning the area, applying betadine if you are not allergic, and covering with a dressing or band-aid. If there are any signs of infection like redness, swelling, pus, heat and pain, please make an appointment with your doctor immediately. If you have difficulty looking after your feet on your own, you may want to ask a family member to help you or make an appointment with a podiatrist. A podiatrist can help you look after your feet by cutting your toenails and looking after your skin. There are also special tests a podiatrist can do to check the feeling in your feet and the circulation to your feet. If you have diabetes, it is recommended that you see a podiatrist at least once a year. If you have pain in your feet, you might want to see a podiatrist to discuss shoes and orthotics. Podiatrists know a lot about shoes and what to look for in a good pair of shoes. If you are shopping for a new pair of shoes, it is important to look for the following: a heel height less than 2.5 centimeters and try to avoid high heels. A wide toe box so there is enough room for your toes. A proper fitting shoe with half a thumb's room at the end from your longest toe, which may not always be your first toe. Good fixation like shoelaces or secure Velcro straps. Shoe strength: when you push on the bottom of the shoe, it should only bend a little bit where your toes would sit. A non-slip rubber sole. And last but not least, a strong heel counter or support in the back of the shoe for ankle support. It is important to remember that you know your feet the best, and if you notice any changes or have any concerns, it is important to book an appointment with your doctor or podiatrist as soon as possible.